In this video, I will talk about trigeminal nerve in a very schematic way that will help you not only to understand but to remember it well for a long period of time. Now, I already emphasized on the nuclei of the trigeminal nerve in my previous video, in which I told you that the cheat code is m square s square, right? Motor nucleus, mesencephalic, sensory, and we have the spinal nucleus. Alright, now since you remember this much, now we will go to trigeminal nerve in more detail. Alright, so it is very interesting. First of all, trigeminal nerve, it has three divisions. This we know: ophthalmic, maxillary, mandibular. Now you also know this is V1, this is V2, this is V3. Alright. Now you should also know that these are sensory and this is sensory plus motor. Alright, this much information is alright to take in. Now the interesting part, in ophthalmic, know that there are three divisions. It gets easier as you revise it again and again. So first division is lacrimal nerve, then is frontal nerve, third is nasociliary. Alright, now frontal, it has further two branches: supratrochlear and supraorbital. Alright, then nasociliary, it has around 5 branches or 4 branches. Now nasociliary has, first is the long ciliary, then branch to ciliary ganglion, then you have infratrochlear nerve, then you have anterior ethmoidal and posterior ethmoidal nerve. Alright, now coming on to the maxillary. Now you will know that the maxillary is going to start from middle cranial fossa. First just know the course: middle cranial fossa, then it will go into something which is pterygopalatine fossa, then from there it will go infraorbital, then from there it will go to face. Just know these 4 blocks that are going to come in the way. Now in middle cranial fossa, the magic happens. Now here it will give meningeal branch. In pterygopalatine, it will give, first is the ganglionic branch, then it will give zygomatic branch, which is zygomaticofacial and zygomaticotemporal, and then one more branch which is the most important: posterior superior alveolar nerve. Now we did PSA, right? Now here you will know that it gives 2 branches, ASA and MSA: medial superior alveolar nerve and anterior superior alveolar nerve. Now face, just know what all it is going to supply. It is going to supply eye, palpebral, nasal, labial. Alright, this is the maxillary division of trigeminal nerve. Now let's talk about mandibular nerve. In mandibular nerve, what happens is, mandibular nerve is something like this. We have a main trunk, then this main trunk divides into 2 anterior and posterior division. Now main trunk gives 2 branches. One is the meningeal branch or nervus spinosus, Then second is nerve to medial pterygoid. Anterior is going to supply muscle of mastication. Posterior is going to have 3 branches. Okay, inferior alveolar nerve, auriculotemporal nerve, lingual nerve. Now, this one is a potential MCQ. Alright, now know that nerve of medial pterygoid supplies medial pterygoid, tensor villi palatini and tensor tympani.